Hey, welcome. Today we're going to talk about something that touches millions of lives but is so often misunderstood until things get really serious. We're talking about addiction. And more specifically, we're going to zero in on those subtle early signs that are just so easy to miss. When you hear the word addiction, your mind probably jumps to a crisis, to some kind of rock bottom moment. But that's not how it usually begins. For most people, it doesn't start with a loud crash. It starts with a whisper, tiny changes that you could easily brush off. And right off the bat, it is so important that we frame this the right way. We are not talking about a moral failing or a lack of willpower here. We're talking about a recognized health condition, one that actually changes how the brain works. The clinical term for this is substance use disorder, or SUD, and the key phrase to focus on is impaired control. This is so crucial because it shows us we're not just talking about a simple choice. SUD is a condition that literally rewires the brain's reward system, and it hijacks decision-making and our ability to regulate emotions. This is where you get things like tolerance, where you need more and more to get the same effect, and withdrawal, those awful symptoms that pop up when the substance is gone. The brain's biology is actually changing. And this quote from our source material really just nails it. It's a gradual process. The early signs are so often overlooked or explained away. And that's exactly what makes spotting it early so tough, but also so important.
Okay, to make this feel a bit more real, let's look at a couple of stories. First, we're going to explore those hidden mental and behavioral changes through the eyes of a college student.
Now, this is a scenario that might sound pretty familiar. A young person, they're at college, they start drinking with friends on the weekends. But then, the pressure from exams and papers starts to build, and suddenly, alcohol isn't just a social thing anymore. It becomes a tool, a way to cope with all that stress. So what were those whispers we talked about? It wasn't some dramatic collapse. It was these little shifts. He got more irritable, his concentration in class started to slide, he even started having memory blackouts, which is a really serious neurological sign, and began blowing off his morning classes. And here's a big one. He started lying about his drinking, hiding just how much was really going on. And this right here, this is probably the biggest hurdle to catching this stuff early. Justification. He, and maybe even his friends, just dismissed it all. Oh, it's just normal college stuff. But when you put all those little signs together, they weren't small at all. They were painting a really clear picture of a problem taking hold. All right, so that's one path, but it's definitely not the only one. Let's look at this from a totally different angle now and see how addiction can take a toll on the body, this time through the story of a working professional. The starting point here is completely different. It's not social at all, it's medical. We're talking about a legitimate prescription for pain after a totally routine surgery. This is a path that, honestly, countless people find themselves on, and they have absolutely no intention of misusing anything. For this person, the red flags were mostly physical. They were always drowsy, which started affecting their work. Maybe they slurred their words sometimes, along with other side effects. But look at that last bullet point, anxiety when the medication isn't around. That is a massive signal for psychological dependence, and it's coupled with the physical sign of taking more than the doctor prescribed. So when you put these two stories side by side, you can really see how differently this can all start. One began socially as a way to cope with stress, and the signs were mostly behavioral at first. The other started with a totally valid medical need, and the signs were more physical. Two completely different journeys, both leading to the exact same health condition. Okay, so we've heard the stories. Now let's try to boil this all down into something useful. How do we take this awareness and turn it into a real tool for spotting these things early, whether it's in ourselves or in someone we care about? So really, if you strip away the specific details of the student or the professional, what are the core patterns we need to learn to recognize? What are the underlying things that tie these very different experiences together? It really comes down to these four main things. First, you've got persistent changes in mood or behavior, like sudden mood swings or pulling away from friends. Second, a decline in physical health that doesn't really have another clear cause. Third, a really noticeable drop in performance, whether it's at school or at work. And finally, and this one is huge, a growing reliance on any substance to manage feelings or to cope with stress. Spotting the signs is the first absolutely vital step, but probably the most important message here is one of hope. It's understanding that there is a clear, structured path forward. Let's be perfectly clear on this. Substance use disorder is a treatable medical condition. Recovery isn't just about willpower or stopping. It's a well-understood process with proven strategies to help people get their lives back. And that process usually looks something like this. It often starts with a safe, medically supervised detox to manage withdrawal. Then comes the really crucial work, psychological and behavioral therapies to get to the root causes. And finally, it's about long-term support to help maintain that recovery. It's definitely a marathon, not a sprint. The word therapy can sound kind of vague, so let's break down what that actually means here. We're talking about proven methods, things like cognitive behavioral therapy, or CBT, which gives people real, practical tools to change the destructive thought patterns that fuel addiction. And that's usually combined with counseling and the incredible power of connection you find in peer support groups. And this brings us right back to where we started. This quote really says it all. Why does hearing that whisper matter so much? Because the earlier someone gets help, the better the outcome. It's about protecting health, relationships, and a person's entire quality of life. So, we'll leave you with this question to think about. We've seen how addiction can start quietly, we've learned the signs to listen for, and we know that recovery is absolutely possible. So the question now is, with this knowledge, how can we all be a little more aware, a little more compassionate, and a bit more proactive in changing the story for the better? Thanks for digging into this with us today.